Hi, let me introduce myself. I'm Deacon Caesar. I'm a Youth in Partnership for Success, and we're a drug and alcohol intervention program. We're going to underprivileged schools, at-risk schools, like one of the schools. Mr. Skeef is at Wisdom High School. That's one of my schools. Albertson Middle School, Elmore Elementary. And what we do is we go in and we teach them curriculum and tell them about drug overdoses, vaping, alcohol, you name it, all different types of things. And we try to teach them and help with the community, because my community at Wisdom, they're 93% economically disadvantaged. So the people at Cashmere Gardens Elementary, 99% economically disadvantaged. So we're in a community that really needs it, and they have issues and they have problems, and overdose is one of the problems, big time problem actually, and opioids is a big problem, as everyone knows. So we're going to discuss some of the problems with it, and I'm going to give you some numbers and help you with that. And let's see. Okay, so we'll get preventing an opioid overdose with naloxone or Narcan. Narcan is the name of it. Naloxone is also another one, but it's the same thing. Naloxone or Narcan, no matter what they call it, it's going to be the same, do the same thing, and I'm going to tell you how it's used and when and how to use it. So opioids and the public health crisis, just a quick overview of that. All right, here's a family of opioids. People don't know. You got natural, which is morphine, codeine, opium, and you also got semi-synthetic, which is a Vicodin. People don't know. Vicodin is an opioid.
I didn't know that.
Very highly addictive.
Not know that part.
Opioid. Percocet, oxycodone, and heroin. Okay? Now, these days, they got the fully synthetic version. Methadone, and that's mostly in China. They're doing the fully synthetic. And really, we're going to get into some of the myths. Can I die from touching fentanyl just by picking up a dollar bill that's going around? You pick up a quarter and it's laced with fentanyl, whether dry or wet. We're going to go into that. But this is a family of opioids. Fentanyl is 50 to 100 times stronger than these other opioids. So as you can see, fentanyl ain't no joke. It is strong. It can be used to treat, prescription opioids, this is what they give you over the counter, can be used to treat moderate to severe pain after surgery or injury. They'll prescribe it, and health conditions, even for cancer, they prescribe opioids. And non-cancer pain, back pain, arthritis, they'll any type of long-term, for long-term effectiveness, they'll prescribe opioids. Anyone who takes prescription opioids can become addicted, so it don't matter. I hate to say it, but I got a buddy, he was on it for back pain, opioids, and he got addicted. And even tried to get me to give him some pills for when I was my knee, for my knee torn meniscus. And I'm like, Doc, we need to get you some help, bro. So, but once they get on it, and they're willing to pay, he was even willing to pay $15, $20 per pill. I'm like, no, it ain't happening. But that's how real it is, just to give y'all the heads up on that. And 1 in 4 patients receiving long-term opioid therapy in the primary care setting struggles with addiction. So 1 out of every 4 can be addicted to this. Side effects: central nervous system, respiratory depression, and potential overdose. Number one thing that will kill you on a fentanyl overdose, and what we use this for, we're going to find out, is your respiratory. They'll start breathing real slow, have trouble breathing, and they'll actually die from that. So tips to reduce prescription opioids: talk to your doctor. Only take prescription medication that's prescribed for you. Don't share medications with others. We actually have a drug take-back program that we do I do 2 times out of the year, 3 times, and then the other people in my group, they'll have them at different locations as well. So we do about, in my organization, Youth in Partnership for Success, we do about 6 drug take-backs a year, 6 to 8 a year. And we'll take them to the Walgreens kiosk and throw them away, because a lot of people, you don't want them in the, you can imagine if this is in the sewer system, and that they go and they turn it into clean water. Or if somebody gets their hand on it, especially a kid at the house, or if somebody gets their hand on it and sell it. So we try to get rid of it. Safely store and dispose, but also talk with your loved one. If you're concerned about opioid misuse, let them know you care about them. Encourage them to get help, like I did my buddy. I encouraged him, hey man, you need to get some help, bro. And that's government find help. But there's places, even at the church, we can guide you and direct you to some places to get you some help. But SAMHSA has a help link there that'll help you find places to get you some help. Okay? Fentanyl 101. It's used in clinical settings since 1968. Fentanyl has been around. The year I was born. Thank you. It's a good year. For pain management. Illicit fentanyl is a primary driver for the overdose crisis today. So the bad stuff is what's getting you. The good stuff, it was doing what it was supposed to do. It's cheap to manufacture, easy to acquire, and concentrating. A little head of this pen could kill you. Fentanyl, just the head of this pen. It comes in white, gray, tan powder. Can be injected, smoked, or snorted. Either way, however you want it. Now they're making it look like candy. They'll make it colored, different colored pills. So the Chinese are very resourceful. And they just want their money. And you also can mix it in heroin, cocaine, meth, and pressed pills. And they're also, believe it or not, are putting it in vapes. They're finding it in vapes. And they're putting it in marijuana, good old-fashioned ganja. They're putting it in that. Okay, so street drugs are laced with fentanyl as well. That's what we just talked about. So you can find the street drugs in there. It is laced with fentanyl now. All right, 6 out of 10, that's 59.6 million counterfeit pills. Not the real deal, but counterfeit was seized by the DEA, had a lethal dose of fentanyl. And that's just what they found. That's a lot of pills. So fentanyl overdose is the #1 cause of death among Americans ages 18 to 45. #1. And not suicide, it's not alcohol, it's not drunk driving, it's good old fentanyl. #1 cause of death, 18 to 45. So here's the myth. Can you overdose just by touching powdered fentanyl? I already gave y'all a hint. The answer is, who says yes? Okay, 1, 2, 3. Who says you cannot? Okay, nobody answered. No, y'all not answering. Yeah, y'all trying to trick me. Okay, that's cool. But question is, can you overdose just by touching powdered fentanyl? And the answer is you cannot by simply touching it. That is a myth, a common myth. But fentanyl must be introduced into the bloodstream or a mucous membrane for someone to feel the effects. It can be snorted in your mouth, inside your eyes, it can probably get your eyes, but just by touching it, no. But a lot of people, they'll touch it, and you know how people, they'll go eat, that'll get them. So, or put their hand in their mouth, or rub their eyes, that'll get them. But just touching it, it won't get you. But, how many of us know we've even come in contact with fentanyl? You don't know. So dissolving the powder in a liquid does not change this property. Wet objects do not pose an increased risk for overdose caused by casual exposure. In other words, if some water gets on me, I'm good, unless it gets in my mouth. Okay, overdose deaths. As you can see, 107,000. And this we got up until 2023. I'm gonna give y'all some numbers that's actually gone down. And I hate to say it, but I'm not trying to be political. I just like to give facts. During the Biden administration, open borders, they were running this stuff in like crazy. And it is what it is. So the deaths, the quantity that was around is a lot more, so more people died. So those numbers have come down because they closed the borders and they're actually trying to do something about it. So I just got to keep it real. Hey, you say what you want about Trump, but at least he's fighting down and trying to get this fentanyl because it is out of control. You can see that. I'm gonna show you some more numbers showing you that. Now look at the leading cause of accidents in 2022. 107,000 overdoses. Car wrecks, 42. Gun violence, 48. Big difference. Big difference. They want to take the guns, but what about the fentanyl? What can I control more, the guns or the fentanyl? I got more control over the fentanyl. You worried about the guns. Concentrate more on that fentanyl. We do the guns too, but concentrate on the fentanyl. And car wrecks is 42,000. Okay, 76% are due to opioids, with 80% due to fentanyl. So as you can see, opioids, 81, fentanyl, synthetic, 73,000 of that is because of that synthetic stuff. Here's the rates per 100,000. You see where Texas ranks in there. Texas is, we're in the lower part. Believe it or not, the high ranking is like West Virginia, the good old mountains of West Virginia, Tennessee, Kentucky, and Louisiana. They killing them in Louisiana. They're not doing it. And so you can see where we sit. But yeah, there's the numbers there. Number 1, number 2, 3, Tennessee, Kentucky, Pennsylvania, Maryland, but our neighbors right there in Louisiana, they're getting them. Texas is 18.2 per 100,000. That's 5,400 deaths, and that's in 2022 as well. And there's just a graph showing you how it's gone up. You can see where it was in 2014, how it jumped up in 2019 on up, and once again, unfortunately, it's related to the border, so it is what it is. You've got more access to. Who's at risk to overdose? People who use it for non-medical reasons, who take them more often than they're prescribed, and people who are snort or injected. So it's pretty much anyone. Basically, that's what it's saying. So nearly 1.2 million have died between 1999 and 2022. That's just getting into some numbers. So they're saying that one person dies every 5 minutes, basically, from this. One person dies every 5 minutes from it. So what is naloxone? What is Narcan? And how does it work? Here's a harm reduction. It reduces harmful consequences associated with human behaviors, both legal and illegal. So sunscreen, bug spray, we know what bike helmets do, condoms, sexual transmitted disease, vaccines, we know what nicotine and gun patches are for, we know all that. Automotive harm reduction for seat belts, airbags, designated drivers, we know that. Opioid harm reduction, naloxone overdose, they have test strips that's available, so you can test to see if it has fentanyl, and they have medication-assisted treatment with it, which is naltrexone, buprenorphine, methadone, and syringe distribution programs, which they have these set up at the high concentrated areas where you can come and get clean syringes and discard your old syringes. You know that program, that's been around a while, so y'all are familiar with that. So Narcan or naloxone. I have naloxone too, but today I only brought Narcan because I have someone that's giving me that. Let me give that out free. They want to charge me for the naloxone at Walgreens, like $5, $5 to $7 for each one. This one that I'm giving y'all has 2 in it. And this one expires August 2028. But I'm going to tell y'all a secret about that as well. We're going to get into that here real quick. Okay. So this reverses. It's not going to prevent it, but it'll reverse. So once you done overdose and they're out, you squirt this in their nose, and it's going to show you how. But this reverses it. It doesn't prevent it. It reverses it. Okay? It is easy and effective. During an opioid overdose, the respiratory, remember I told y'all the main thing it does is the respiratory and the central nervous systems are depressed. Breathing slows or it'll stop. If they die on you, you know that they'll stop breathing. but that's what happens. And naloxone, it blocks the effects of these opioids. So that's what it does for time. Second, okay. Okay, gotcha. Okay, so naloxone, it'll block the effects of opioids and reverse an overdose. So it allows a person to breathe normally. They're having problems breathing, can't breathe. You squirt that in their nose, they'll breathe. And if the first one don't work, it's gonna show you. You give them a little bit of time, and then you shoot them again with the second one. It won't. You know, they're about to die. So it's not like it's gonna kill them. This won't hurt them. And then sometimes we misdiagnose. They may just be sloppy drunk. We don't know they're sloppy drunk or if they're overdosing. So we shoot them with that. And okay, oh well, I'm worried I'm gonna kill them. No, this will not kill them. But if they're overdosing, it'll bring them back to life. So if you have to use a second one, go ahead and use it. Okay, so it's safe for people of all ages. Youth, because kids are dying too from this. Infants to the elderly. Has no side effects and will not harm a person if opioids are absent. Like I said, we think they overdosed. We don't know. Could have just had a bad night. I don't know. But he would wake up. He was cold and clammy. Yeah, those are symptoms. He was breathing slow. Yeah, but he also might have been up 3 days, 4 days drinking. We don't know. Okay, so it's the same concept as CPR, AEDs, EpiPens. It migrates the damage caused by a negative reaction to the body. Overdose prevention tips for people who use drugs. So this is more geared towards, this is good stuff, but it's more geared towards the people that are actually using drugs. Some of this stuff, when I trained and looked at this stuff, I'm like, man, they're telling people to do drugs with other people, but it saves lives. They don't want them doing drugs by themselves. So they try to tell them, or have a door open, or let somebody know you get ready to do drugs. Now why am I giving this? But they say you gotta do it because it saves lives. You gotta give the information because it saves lives. So don't mix drugs. If you're gonna do drugs, do one at a time. Avoid mixing alcohol and opioids. Tolerance. If you haven't done it for a while, go slow. Don't just try to do a tester shot or snort it instead of injecting it. Test it. Know what the drugs can help in the decision on how much and what's best to use it. Unbelievable. Quality. Try to buy from the same dealer. Know the pills you're taking and careful when switching the type of opioids. Using it alone. Do it with a friend. Develop a plan with a friend or partner. If he die on you, the other one, get some help. It saves lives though. Okay, so be mindful that injecting and smoking can increase risk. Consider snorting when using alone or decrease tolerance. So, smoking it, because it goes directly to the lungs. Remember I said it stops the breathing? So smoking it is worse than, and injecting it is worse. Snorting it is easier on you than, Okay, have naloxone. That's the number one thing they want to tell them. The test strips, and that's just a tool to prevent overdoses. It's easy to use, low-cost method for detecting fentanyl. So, I've seen them, and of course, I'm not going to have no fentanyl to test them, but I've heard they do work. It does not measure how much fentanyl is contained in a drug, though. It just says, hey, it's in there. It could be enough to kill you, or it may not be enough to kill you. So that's why it's crazy they make it, but they do. Okay, signs and symptoms. May be unresponsive. Can touch them, they won't move. Can't be awake and can't talk. Body may feel limp. Skin cold and clammy. Remember I said that? Blue or purple lips or fingernails. They're vomiting, gurgling, or choking noises. Slow breath. That's the number one thing you're going to see. Slow breath. That's the first thing you're going to see, actually. Respiration or heartbeat. But some of these things are the same thing as drunk. For me, some of these things. But
heart attack. Did you use water?
Heart attack, but you can smell. Okay, let's see. All right. Got a little video for y'all. Let's see here. And it's gonna show y'all how to administer it.
Administering naloxone is a critical step in saving the life of someone who may be experiencing an opioid overdose. The person does not need to be breathing for naloxone to be effective. After administering naloxone, CPR and rescue breathing should only be performed if you are trained or certified. Confirm the overdose by trying to wake the person and observe for the following symptoms. Check for unresponsiveness. Their body may feel limp. Their skin might be cold and clammy. Lips or fingernails may appear purple or blue. Look for signs of distress. They may be vomiting, gurgling, or making choking noises. Breathing or heartbeat may be slow or stopped. Call 911 and ensure that emergency services are on the way. Open the naloxone package by peeling back the tab. Hold the naloxone device with your thumb at the bottom of the plunger and place your first and middle fingers on either side of the nozzle. Gently tilt the person's head back and provide support under their neck. Carefully insert the nozzle's tip until your fingers touch the bottom of their nose. Firmly press the plunger to administer the entire dose into one nostril. Move the person onto their side and into the recovery position by extending the arm closest to you at a right angle, palm facing up. Use your free hand to bend the person's knee that's furthest away from you into a right angle. Gently roll the person onto their side by pulling the bent knee towards you. The bent arm should cradle their head. Ensure that their bent leg remains at a right angle and make sure their airway is clear of obstruction. Allow some space and closely monitor them. If there is no response after 2 to 3 minutes, additional doses of naloxone can be administered every 2 to 3 minutes, switching nostrils until help arrives. Following naloxone administration, the individual may start to wake up. Pupils may begin to dilate, respirations may begin to increase. They might feel disoriented, scared, or nauseated. Naloxone often leads to withdrawal symptoms, which can be distressing. These symptoms may include chills, excessive sweating, fever, intense pain sensations, nausea, muscle cramping, anxiety, and a racing heart. It's important to give the person some space and avoid physical contact, as even a light touch can be painful during withdrawal. Comfort the person and explain what just happened. If police or emergency responders are present, let the individual know they are there to help and reassure them that they are not in trouble.
And something else, just another, let's see, it may talk about it, but if not, I'm gonna tell you about it anyway. There's a chance, once they come off of this, that they go back into an overdose. Because what this does is just blocks it. So they're coming off, and she already told you stay away from them, watch out. They're very sensitive, they're cranky, they don't know what's going on around them. So give them their space, tell them what's going on, tell them what you did, and also keep monitoring. Hopefully 911 is coming to take care of it, because if you're there and you're stuck with them, what you're gonna have to deal with is once this Narcan wears off, they go back into overdose mode. Yeah, so crazy. But this is good for so long. So once they gonna go back into overdose mode. So it's important to keep them up, to keep monitoring them, and keep ready just in case you have to hit them with another shot. But call 911, open the medication packet. That's what it looks like, opened up. And then you go just middle finger, thumb there, and then 2 fingers there, and boom, into one nostril. Tilt the head back, support under the neck, insert tip 1, and don't play around, put the whole thing in there. Shoot the whole thing in there until it's completely empty. And they don't have to be breathing for it to be effective. That got me, I said, huh? But yeah, it can go in there and do its thing and still work, all right? And you do the CPR though, of course, but try to get them back breathing. If there's no response after 2 or 3 minutes, go to the other nostril, hit them again. That's why these kits I got me have 2 of them, man. Each one of them has 2. So if y'all didn't get one downstairs, they were in the little gift bags, the black and pink gift bags. If you didn't get one, I have more up here. And I want everybody to take one. I actually ride around with one in my truck because I'm moving. I'm at schools all the time. I'm here at the church. Believe it or not, we got people coming in off the street. We got a lot of traffic around here. People doing drugs and everything else. So we deal with a lot here at the church and at the schools. So that's why I keep one on me at all times. Okay. We got people begin to dilate, respiratory begin to increase. They feel disoriented, scared, or nauseated. She talked about that. So just be aware they're gonna be cranky and crazy. So we know about the chills, the sweat and fever, all that stuff. Let the medics deal with that until they come back around. That's just reiterating. And making it available does not encourage people to use more. It's just a preventive device. And it's a bridge between you and 911. It's not don't give it to them and think, oh, they're cured, they made it. No, they haven't. Because remember I said they can go back into an overdose state. So we don't want them going back into an overdose state. So, repeat dose, yeah, we know that. It may last, remember I said 30 to 60 minutes. That's the time I was looking for. 30 to 60 minutes, and then they may go back into that overdose. So that's why you want to make sure you call 911. Don't think you can do it all by yourself. All right, don't expose it to the children. Packages, they do have expiration date. I told y'all this one, 2028. But check this out. Here's a frequently asked question. Somebody asked me that when I was giving them out today, earlier. When's the expiration date? It don't matter. Question is, if you don't know, can you administer naloxone if you don't know what drugs or medication the person took? Yes. It's not going to cause harm. If they took different type of, we don't know what they got. So no, yeah, you can still administer. Once it has occurred, how much time is there to administer the next one? Case by case, but 2 to 3 minutes. If it's expired, is it okay to use? Absolutely. You'd rather have you standing there, man, why did you give the EMT, why didn't you give them the Narcan? You had Narcan? Oh, it was expired. Come on now. Shoot them up. They'd rather be alive. So don't worry about it if it's expired. Is it okay? Same thing. If it's exposed heat or cold, we don't know. So yeah, you still use it. You're going to give them a chance to live. Yes, and this is another medication. They're real expensive, so that's why we don't have that. It's a different type of it. Do I need to give more naloxone? Give it more. Is only if you need to. Don't overdo it. If they're up, don't overdo it. Because, and here's why. Remember, every time you give them a dose of this, everything is going to make them real sensitive. So they're going to be very uncomfortable. They're alive, but the more you give them, the more uncomfortable it will be. So if they're already up, don't keep giving it to them just to give it to them. Only give it to them if they need it. And here's the laws, and it doesn't affect it. It's a Good Samaritan, but one thing I do want to tell y'all, we have the Good Samaritan law that protects you. So if you give it to them, they're dying, you think they're dying, and you give it to them, you're protected by the Good Samaritan law. So you don't have to be scared to get arrested. And the good news about this is they can't come back. They've already proven, and the government, everybody knows that this there's no side effects to it. It won't kill somebody, even if they're not having an opioid overdose. So you don't have to worry about the law coming to you. That Good Samaritan law, and then what Narcan says, that it's no side effects and it won't kill them. Cool? And this is how you get it. Your pharmacy has it, local organization. I get it from a distributor. So if you need some, or you're in a school, or you work at a halfway house, or like Coach, I know Coach deals with a lot of kids over there. He may want a few more. You get with me, I can get you some. That's no problem, because I have access to it. Okay? And that's a wrap. All right. I appreciate y'all so much. And hopefully y'all got something out of it. And does anybody need any Narcan, or did y'all get some from downstairs?
I got one.
Okay.
Everybody
Well,
else can
if
get
you
one.
want one.